Everywhere across America, you're listening to Alliance for the Brave, where we bring education, information, and communication to today's veterans, active duty military, first responders, and God bless those medical professionals and the American patriots who'll join us. I'm Jim Light, U.S. Navy veteran. Joining me, London Mason, my U.S. Army veteran. And this is a great day. Welcome aboard.
Good morning, Jim. And let me please quickly add, tune in, join in, and plug in, and subscribe to our YouTube channel. Make sure that you do that. Jim, I did it last night. It is awesome. It's got a lot of videos, a lot of our older subscriptions.
Well, here's the good
You got to get on board.
Yeah, you can go back and watch it. Here's the
Of course.
news. You get to watch me. Not a good deal. Guys, it is a huge honor and a great privilege to introduce Dr. Wendell Jones, MD, MBA, Network Director of VISN17. That's the heart of Texas healthcare system. Dr. Jones, welcome aboard. Guys, we're glad to have you.
Good morning. Glad to be here today.
Hey, it's a beautiful day, and VISN17, you're over the state of Texas except for Houston, so you're over all of the facilities throughout Texas, correct?
Yes, sir. And VISN stands for Veterans Integrated Service Network, which pretty much is a region. We're divided in 18 regions, so I'm the network director of VISN17.
Now, you've been with the VAs back since, I think we were using sales and orders, maybe?
Yeah, I've been with the VA since October of 1988. Had a long history of service to the country with both of my family, with my father serving, as well as my wife's family. Her father was a Vietnam vet.
Wow. Well, he and I probably were over there about the same time. Long ago and far away. So, what motivated you, Dr. Jones, to go into the VA field? What brought you to the service of our country and to our veterans?
Sure. Well, that was part of it, and that I've always admired family members that serve. I've always admired friends that serve. So that was part of my DNA from the beginning. I then, well, let me just start from growing up in Baltimore. I went from Baltimore to college in Atlanta. I went to Morehouse College. At Morehouse, I went to college with a couple of people you may or may not know. Jay Johnson was head of Homeland Security under Obama. He was a year before me. Got in Spike Lee.
Oh, yeah.
Was a year before me. Marty King, who was Martin Luther King III. Went to school with me, so got to know a number of good guys there. From Morehouse College, I went to the medical school there. We were early. We were combined with Emory, so I trained at Grady, which is a public hospital there. Went from Atlanta to Miami, so I did internal medicine in Miami, and I trained at Jackson Memorial Hospital, which is a part of Miami, so we saw all kinds of interesting disease patterns there. And of course, the Veterans Administration Hospital is right across the street, so we went back and forth and trained and learned a lot from the great clinicians there.
You were an emergency room specialist, which I think is amazing because you get hit, bang, 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 bang. Yes. Everything's different. Yes. Everything's fast. You can't say, oh, nurse, I need a 20-minute coffee break.
Right. Yeah. And Dr. Jones, what's the traffic like? Because you were telling us before we came on the air, what was that experience like working with that?
Yeah, it was a great experience. As I mentioned, Jackson Memorial Hospital and the VA there in Miami served just a large number of people. We got to see, as I mentioned again, a number of different diseases. Folks would come in from South America, they come off the plane and go straight to Jackson, straight to the ER. So they would literally come up to
quite an experience
from hot. Great experience. From the VA and Jackson, I joined the emergency group. So I worked in 2 emergency rooms. And what happened was I said, I want to get my MBA. I had the seed been planted by a previous.
It's a business. You got to balance the budget, right?
Yeah, it does help. When you're trained as a physician or a nurse, you're trained to treat that patient and zero in on that patient. That's what you really want as a patient. You want your doctor or nurse to look at you and treat you. However, if you go and get a master's in public health or an MBA, you change your perspective. Now you look at populations. So you're trained to take care of populations. So the 180 difference. And if you push those together, combine those, integrate that training, then you can use that to serve both people as individuals and populations.
Makes sense.
And that, I guess that is a wonderful thing about having you on board, because when you take a look at our Texas and our North Texas situation, you and Dr. Holt both being medical professionals, both being administrative professionals, we have the second largest VA in the United States,
Yes.
correct?
That's correct.
And we have the ratings, thanks to you guys, of being probably one of the best hospital systems, whether it's civilian, private, or military in the United States,
Yes.
correct?
Yes, there are quality scores that we look at, and you can actually go online and look at different quality scores among hospitals. And if you look at our scores and compare them with some of the private hospitals, we're just as good with most of those scores or better in some areas than many of our community hospitals. So we try to do the best things. No one's perfect. No hospital or provider is perfect, but we try to do the best that we can, and we do a great job.
Okay, for a lot of people who are civilians or patriots, or even veterans who are not plugged into the system, what is the job of VISN17? What do you guys do? How do you integrate? So you're over all of the state of Texas except Houston.
Right.
So it kind of explain what your responsibility, what you're going to do, because we're going to segue into where are you going?
Sure. So VISN17, or to some folks it's Region 17, but VISN17 is comprised of 7 large medical systems, medical centers with 56 clinics, 6 nursing homes, and 6 DOMs, or domiciliaries, which really...
Whoa.
Yeah, they treat, the domiciliaries house those that have been faced with challenges in their life and sometimes come down with substance abuse problems. We pull those particular veterans in, we get them back to work, get them back to the community. We do a great job with that. So that's the composition of VISN17. So we, our staff at the VISN, are the heads of, or the leads for clinical and administrative care for the VISN.
That is amazing. So when you think about this, you're talking about, you have El Paso, you have Temple Belton, you've got Dallas, you've got Amarillo, you've got all of that. There is a huge list. I actually went on the VISN17 website to get your background, but I looked at the number of facilities, and good grief, I mean, that's a huge, and so you're over all of that, the operations, yes, the integration, and I think a lot of people don't know how integrated the VA healthcare system is to the community as well. You guys also serve the community. Can you explain a little bit about that?
Sure. We start with DOD. We integrate with DOD, and we work with several bases in really the transition of care from they start as active duty soldiers and then become veterans. So they go from active duty to veterans and have care under us. We also are integrated with several medical schools, nursing schools, pharmacy schools, etc., and providing education for those that are training with the medical field. I did that myself.
Well, now, you are on the staff at UT Southwestern.
Yes.
And I know Dr. Hastings is on the staff at UT Southwestern in cardiology.
Yes.
I bet you didn't know I knew so much about you guys.
You do your research.
Yeah.
So, yes, we both help with teaching future doctors, residents, in internal medicine. We have surgical programs. We have mental health programs. I mentioned nursing programs, pharmacy, other areas of healthcare. And we help train future providers through the VA.
Nice.
You know, one of the things that I've been told repeatedly, the 70% of all the medical professionals in the United States have some training at the VA in their early career. That's pretty amazing. So if somebody was interested in joining the VA healthcare system, whether it's here, in Virginia, in Arizona, or whatever, what would they where would they go to find out more about going to work for the VA healthcare system?
Sure, there are a couple different ways. They could call 214-742-8387, which is the Dallas VA, if they're in this area, and they can just tell them just that. I'm interested in providing care for our veterans. I'm interested in health care. How do I go about it? There's also a website, USA Jobs, where you can look at particular needs for a particular veterans healthcare system, and you can try to match your skills with the needs of that particular medical system and see if they match.
Dan, the VA is constantly hiring, from what I understand.
Yeah. We actually are hiring, especially during these days, because we have to meet the needs of those veterans that are growing older. You see more and more veterans advancing.
You mean like me?
Wasn't looking at you in that instance.
You were looking at me. I got that.
Yeah. So we are more and more veterans who are growing older, and that's a good thing, and we want to keep them healthy. Yeah. More and more veterans are taking care of some of the needs that in the past veterans didn't necessarily take care of. For example, I'm a male, and sometimes you got to get your wife to convince you to go to get your health care. Right. And they're doing that.
You mean even as a doctor, you go there? Oops. Yeah. Guilty.
Yes.
All right. I tell you what, this is really an important conversation. Before we go to a break, I want to inject real quick, because you're talking about taking care of yourself. Go get vaccinated.
Absolutely. That's the number one thing you can do these days, and we can talk a little bit more about that.
We're going to be talking about that when we come back from this break. This is an important conversation. Dr. Wendell Jones, the director of VISN17, state of Texas, he is a medical doctor, emergency room specialist. He is my new best friend, because I got to tell you, you need to have a doctor in the house, and we've got a great one. So I'm thrilled to have you on board, thrilled to be a part of this. So we'll be right back after these words as we talk more about VISN17 and where it's going and what you can do to get plugged in. This is Jim Blythe with London Mason with Dr. Wendell Jones. This is Alliance for the Brave. This is your station for education, information, and communication. We'll be right back after all these words. We are so thrilled to have you, and this is an amazing opportunity to get to know you and talk about this. Okay. So it's just really great. In doing this, again, I mentioned get a vaccination.
Oh, it's so important. What can we do to prevent any further spread of this disease? Of course, we can't eradicate it totally or prevent risk totally by getting a vaccination, but you can do an awful lot.
Yeah.
If you look at...
We're good. I just need you to have the mic for it. Get it a little bit closer to your face, because you're a little off.
Yeah, if you can get, there you go, just a little bit closer.
Okay.
See, here's the difference. Us military guys learn to shout. You doctors,
exactly.
You're trained to be gentle and quiet.
Yeah. So, going back to vaccination. So, I understand that some folks are concerned about the risk of vaccinations, but really, the risk is extremely low. I think the biggest risk of going to get a vaccination is getting in your car and getting on the highway and driving there.
Yeah, of course.
Well, as I mentioned to you, and I talked to London, when we finish today's program, I'm flying on my plane down to San Antonio to attend the funeral of my cousin. My cousin and I grew up together. We were both only children. We were like brothers. He's a U.S. Army veteran who served in Vietnam in the Army. He was an oil driller, and so in Vietnam, he drilled water wells to provide clean water. And I got to tell you, Mickey didn't want to take the vaccine. He got COVID, about a week, put him on a ventilator, didn't work. I have had so many people that I know that have passed away from this. And if you'd had the vaccine, the chances of you getting it are remote, but more than that, your ability to survive. Now, I have another pair of friends up in Henrietta, Oklahoma. Both of them had been vaccinated. Both of them got COVID-19, the Delta variant. And for him, it was like having a bad cold. But she had underlying conditions of diabetes, just like my cousin Mickey had an underlying condition of asthma. With that, she was in the hospital about 3 weeks, but she's back home doing well. And that's with the Delta variant. So if you have the vaccination, and even if you get the Delta variant, your chances of survival are so much higher.
Yes. You know, in our ICUs, the number of people that are unvaccinated are greater than 90% versus those vaccinated.
When we get back on the air, Dr. Jones, let's make that point.
Yes. Sure. I mean, that's the best thing you can do. Well, it's just going in and getting a shot. And like I said, that risk of having a reaction to that shot is extremely, extremely low.
Dr. Jones, any of us that are veterans went through those shots before we got overseas. All right, guys, here we go. Thank you for being with us on Facebook. Send us a note. We'll ask Dr. Jones a question. Thank you for all being on board. We'll be right back on the air on our broadcast.
You're listening to Alliance for the Brave, honoring, serving, and empowering those who serve our great country in the line of duty. Today's program is presented by Gear Services Web Design. Learn more about our mission and how you can plug in with us at allianceforthebrave.com. Now, back to the conversation.
Welcome back. We're having a lot of fun today in the studio, cutting up, and I got to tell you, we've got a really great medical doctor who is also an administrator, Dr. Wendell Jones, the new head of VISN17. That's the state of Texas, the heart of Texas. Dr. Jones, thank you again for being on board with London and I. We were making a point. I want to make the point again. Get a vaccination. You were saying your chance of having a reaction is fairly low. Yeah, you may have a sore arm. Yeah, you may feel bad, but dying ain't no fun.
That's right. Your chance of having a reaction is extremely low. And I mentioned that the biggest risk that you take when you go to get a vaccination is getting in your car and driving to wherever it is.
Yeah, in many of our major cities, that's for sure.
And Dr. Jones, I got a question for you. I know it's circulating in the media now today about the booster. Now, my question to you would be, like the VA, do you think somewhere down the line that it's going to be required for that? And is it required right now for the staff for the shot? So
there's a mandate now that staff at the VA have to get vaccinated, either with Johnson & Johnson 1 vaccination or the other 2 with 2. Now, it's suggested that anybody with an immunocompromised condition now get a booster. So that's say if you have cancer, you're receiving chemotherapy, yeah, you need a booster now. And you heard the president over this last week that announced that starting September 20th, the booster will be available for all. So 8 months after you were vaccinated with your second dose, you're eligible to get a booster.
Okay.
So, and that's really just awakening some of your antibodies to fight off any of the variants that come across. So you have just extra extra help.
Because there's so many people out there even now. You know, if you're afraid of the first shot, now we're talking about another one. So that's why.
And I know a lot of people that have been uncomfortable or spent a day or two in bed, but it's so important to get it. And you were telling me that in your ER at the VA, 90% of the people?
So in the ICUs, so intensive care units at our VAs, if we look at the percentage of those that are there that are unvaccinated, it's over 90%. So what's that telling us? That's telling us you're at much more of a risk being unvaccinated than if you were vaccinated.
Boy, let me tell you, when they got the booster, watch Jimmy go. I'm gonna be a track star. I'm gonna be down there getting my shot, and I have the Pfizer. I had both of those. I didn't have any. I had more reaction when we got the overseas shots, you know, and we got vaccinated for everything imaginable.
Yeah.
So
you remember the standing in line and
oh goodness gracious, yes, London, and heaven. And then part of what I was in maintenance administration with aircraft in the Navy on the carriers, but I also helped out in every shop, and I helped out with the ordnance shop. And boy, let me tell you try and lift bombs when you got sore arms. That is no fun. But let's again. Where can you go? Well, check with your medical professional if you're not in the VA. In the VA, call the VA. We also have fabulous telemedicine.
Yes.
So if you're struggling and you think, now, my cousin that I'm going to the funeral this afternoon, I talked to him about 2 weeks ago. He said, hey, Jimmy, I've had this cold, and man, I feel bad, and so I'm going to go lay down for a little bit. If you think you've got a cold, go get tested. If you've never been vaccinated, go get tested. Go get vaccinated. Mickey would still be with me today, and this is a heartbreaking deal for me because he was my brother. I got to tell you, it was preventable.
Yes. So I think really that's a teaching moment for everyone, that if you have something that you're not quite sure of, you know, the risk of you going to get it checked out is so low versus the benefit.
Absolutely. All right. We're having a great time talking with Dr. Wendell Jones, the head of the Heart of Texas, the VA-17. This is an important conversation because we want you to plug in, tune in, and be a part of the VA healthcare system. This is not the VA healthcare system of 10 or 20 years ago. This is fantastic. The healthcare they've got, telemedicine, all of these things we're going to be talking with Dr. Jones about what is some of his vision for the VA going forward. So this is Jim Blythe and Lyndon Mason with Dr. Wendell Jones, and we'll be right back after these words from all of our partners. You're listening to Alliance for the Brave. We're here for you. Friend, Chris, ask Diane to bring me some Fisherman's Friend, please. Fisherman's Friend is a radio secret that goes back to, I don't know, many, many years. And it clears up your sinuses about that fast. It's the most powerful that you can get.
Oh,
and
smart.
When I first started doing radio when I was 16, a guy showed me this. In London, do you need one?
Oh, yes, sir.
Okay.
I'll try one.
All right. Now, let me tell you, Dr. Jones, this is a little bit powerful.
Okay.
But it will clear your sinuses.
It definitely will.
Okay. I think I can take it. Fisherman's Friend. Okay.
And if you've got a speaking engagement to do, you call me and I'll bring you some of this stuff. I'll go buy it.
Where do you pick them up?
Well, right now, CVS and Walgreens are carrying it. Used to, there were only one place in Dallas that had it.
I got you in my talk for a second.
All right.
Yeah.
All right, so you want to test this one out? Okay. You know, one of the things I found is I had an accident with a horse many years ago and I lost. So I have a left knee that's not too good. I tried the stem cell deal. Yeah, it was about 50%. Yeah. And then I used a medical laser to treat it. I'm 100%, but I use an elliptical trainer because it doesn't pound your knees or
Yes.
ankles.
Yes.
Are we good?
Yeah, it's good. I just got tightened it, or unless you want to wild with mine.
But also, like, I love watching sports. I'm waiting for next week when the college football season starts.
Oh yeah, you and me both.
NFL.
Oh yeah.
I tell you what, we need to have a party. We'll get Too Tall to come over.
There we go.
He is just one of the most delightful guys I've ever met.
Yeah. I was with Russell Maryland last night.
Oh wow.
He's a great guy.
Oh yeah. You and I have been blessed to meet a lot of great people.
Yeah.
You mentioned that you had met, I think, Martin Luther King's son or grandson.
That's his Martin Luther King. The one you know is the second.
Yeah.
And the third is his son. So yeah.
Wow.
Well, I met Martin Luther King Jr.
Oh, okay.
Yeah, when he came to SMU in 1966
Wow.
and spoke, I got a chance to meet him. That was the most intense human being I ever met in my life.
Yeah.
You looked in his eyes, and he wasn't physically a big man,
Right.
but his presence was just
Yeah.
unbelievable.
Yes.
And he gave a speech at McFarland Auditorium. It was great.
Texas links on
Services Web Design. Visit us on Facebook or online at allianceforthebrave.com. And now back to Alliance for the Brave.
Well, welcome back, London. We are so blessed to have Dr. Wendell Jones, the new director of VISN17. Your experience, as we were talking about before with the VA, goes back to the 1980s, 1988.
That's right.
Wow.
Yeah.
You know, I got to tell you, whatever you're doing, keep doing it because you don't look at
I know.
You don't look,
Yeah. And Dr. Jones, I got a question for you, too. I know you were telling us about the VISNs and how many hospitals. What was the purpose of leaving Houston on a, them being a separate entity to
Right.
VISN17?
That's a good question. If you think back, we had a secretary that was a former CEO from Procter & Gamble. His name was Secretary McDonald. And his vision was to have Texas as one region itself. We incorporated, at that time, Amarillo, Big Spring, and El Paso into our region or our VISN. So we were successful doing that. We were on the path to incorporate Houston. However, the secretaries changed. Secretary Shulkin saw it a different way. He wanted to keep Houston part of the next VISN to the east, which is VISN16. So we still have a number of collaborative ventures with Houston. I know the director well, and I've been there. So we do have ventures, especially with mental health with Houston. Houston's a great research hospital, great system for research as well as patient care. So we do collaborate with them, but they're not officially part of our VISN. Yes, sir.
One of the things when you mention research, a lot of people don't know that each of the VISNs has a center of excellence. And we have an incredible center of excellence down in Waco.
Yeah.
And I know Dr. Richard Symes, who runs that. And they're doing a tremendous amount of research.
Yes.
It's part of what you do.
Yes. So that particular center of excellence concentrates on research on returning veteran illness. So they concentrate on things such as PTSD. It's very interesting. Say if one soldier can go and experience one thing and his fellow soldier can experience the same exact thing. The first one might come back with terrible PTSD. The second one might come back with minor symptoms or none at all. What does that? What is it that makes the brain react different ways? We don't know yet. We're still fairly primitive in a lot of our neurosciences compared to, say, something like cardiology. I think we got the heart down and some of the other organs down, but the brain is so complex. So we're trying to figure out what we can do to prevent this kind of illness for veterans returning from war, returning from combat, and experiencing things that might impact the rest of their lives.
There was a movement a number of years ago to totally do away with the VA and turn you into an insurance system. But one of the points that I had in talking with your predecessor, with Dr. Holt, with other people who've been involved in the VA, because I've been involved with you guys now for 7 years, always made a point of veterans have different medical issues.
Yes.
And sometimes it's like peeling back an onion. So you may get a veteran in for one issue, and yet then you begin to find underlying issues. And so that's why our VA healthcare system, which is oriented to the combat veteran, to the veteran, whether you serve combat or not. Yeah.
And serving as a peer specialist, what I've discovered as well, and I've been doing this for quite some time, is that when you alluded to 2 veterans, both of them PTSD, one more severe than the other one, what I've discovered is the experience, what they've been through, what they've been able to see, what they've been able to feel, touch, look at, has a lot to do with, and I don't know the other part of it, but I just know the practical part is my experience is going to be definitely different from yours, different from Jim, Vietnam era, but we all can see it as a combat experience, but we feel it different.
Right.
So that's just the practicalness. I just wouldn't know like you said, the medical part.
Right. So many of our physicians, our nurses, our pharmacists, our other, even our clerks, are veterans themselves. So they can really relate to those experiences that other veterans go through. And as you mentioned, there's peer support. There are things that you can do to help your fellow veteran that other folks just can't relate to. Or there even those that have been in the VA for decades that even though they might not have served themselves, they can learn through their experiences how to relate to veterans. So that's the difference between getting your care at VA and outside VA many times, that the way that the approach to the veteran is just, it's a different approach within VA than outside VA.
I think it's also very, very important for veterans to know that you don't have to go to the big box, the big, huge hospital. There are clinics all over. You can go to, I went to the VISN17 for the state of Texas. You can go to the VA, find the locations, but you also have telemedicine. Yes. So if you're signed up for the VA, you plug into a doctor. And this is a VA doctor. This is not a normal, regular doctor. It is a doctor trained to work with veterans.
Yes.
And I think that's incredibly important because it helps the veteran to know, hey, if nothing else, I'm a phone call away from a doctor.
Yes. And the interesting thing about telemedicine is I was around when it started, and some of the people were very reluctant to treat mental health patients with this means of treating them by almost by television. And the interesting part of that was that many mental health patients actually like being treated this way so they don't have to leave their homes. They might be just reluctant to leave their homes because they don't want to be around a lot of people. So it's very good that they can get care via telemeans rather than actually having to go get in the parking lot, standing in line, waiting in the waiting room, seeing your provider coming out. You know, you go through all that face to face. But many are much more comfortable with just sitting at home and talking to their provider that way.
Let me make a point too, Dr. Jones. This is a different VA than even 10 years ago. And I'm a certified senior advisor. I work with the elderly in providing financial counseling and things as it relates to their home. But what I have found time and time again is I'm sitting there with a veteran and I'm having to shout at him because I can't hear. And I go, okay, you're a veteran, right? Why haven't you gone to the VA? Well, I'm afraid of the paperwork. Okay, we have in Texas, we have county veteran service officers, free. There are accredited VA reps throughout the nation, through DAV, through VFW, through American Legion. You can find an accredited rep who is free and can get you and do the paperwork. You don't want to tackle that stuff by yourself. but it's there and it is available in terms of help. I helped a family in Richmond, Virginia get hooked up with a DAV accredited rep, and within less than a week, they were able to get the aid and attendance. This was a World War II veteran. We're able to get the aid and attendance, plus his wife became a beneficiary, so that when he was gone, she had benefits capable of being used. And that was explained to her. So it's easier today than you think. So if you're a Vietnam veteran, if you're a Korean War veteran, you're afraid of the paperwork, you hate paperwork, I hate it, but I live with it. There are people that can get you through that process, correct?
Absolutely, and there's one sitting right to my right here.
Yeah.
He's helped a lot of veterans get through that process.
Oh yeah, definitely.
Makes it a lot
And
easier.
I've been able to at least, and I know being a veteran service officer is not my lane, but at least I can point them in the right direction. I want to be able to give them the right information. I don't want to be guilty of the individual trying to give you all of this information, because just like Jim said, I try to do it myself, and it's not a pretty picture.
Well,
So
I went
you
to
know.
I went to Dallas County, and they took care of me, and we got it all put together.
Yeah.
And I think it's important that people know that, because you have all of these facilities. You have telemedicine. We're here. And if you're not signed up to the VA, I highly recommend you get signed up to the VA. You can use your physician. You can stay in Medicare if you want. But it's important to get the help you need. And it's important for your family as well, because a lot of times people don't understand. And if I knew one, I've known 1,000 who say, "No, Jim, I don't need to go see a doctor." We were laughing about this. Your wife kicks your butt, right?
That's right.
Mine does too. And you're a doctor.
I know. We're not the best patients at some time.
No, tough it out. That's a good way to get killed. And I think that we've got to understand. Now, what I'm getting into your time, we're going to have to do this again, but what is some of your vision going forward? What are some of the things that you would like to get accomplished for VISN17?
Well, number one, everyone's facing this pandemic, so we have to care for patients, veterans in this case, that have gone through the pandemic. Unfortunately, even though you might treat their acute condition, we're seeing people with chronic conditions. So unfortunately, this virus itself impacts organ systems, and then it wakens up some of the problems that you might have had before, unfortunately. So trying to deal with this pandemic is my number one thing. We deal with that every day. We also are doing other things. We're looking at the principles of something called a high reliable organization. We're looking at processes and trying to improve processes, not just improve the job of an individual, but a group of individuals. We're trying to impress upon others continuous learning so we can always get better. We talked about the research. This is a new disease, so we're trying to look at this disease and see if there are ways that we can approach treatment to make things better for veterans. We're looking at whole health, where we look at self-care and try to build plans for veterans, how they can treat themselves. We are providing things like yoga lessons, mindfulness or meditation, things that are a little bit out of the box, acupuncture. So try to combine health and wellness for the whole person into making people's lives better. These are these are things I'm looking at and trying to push and trying to make all of our staff excellent in treating our veterans.
I think that's incredible. And I've done acupuncture. It works. You feel kind of crazy looking down, and you look like a porcupine for a minute. But these things work. And one of the things that we're learning, you talked about neurology. We're learning things about the mind that 20, 30 years ago we didn't know, and how pathways can be rebuilt. We've had the Center for Brain Health. We've had Dr. Ben Galliard on. We've talked about how even people with PTS, with strokes, can rebuild pathways. And we've seen it happen. And there's other new medical technologies that we are seeing today that we didn't see 10 years ago, and incorporating that, which is important, because what a lot of people don't realize, and you've been in the VA for a long time, but I haven't, and what I realize is the VA leads the nation in innovative things.
Oh, yes. We've done research in all kinds of things. Heart disease. We have advanced prosthetics. Of course, we had many veterans that have faced challenges with that, so it gave us many patients in which we needed to do things for them. They faced us, and we were able to help them. So I just keep preaching the research, the education, the continuous learning, the proper treatment, the excellence that we try to get all our patients involved in, as well as staff.
I think that this is integrally important of being able to do that, because the Navy was all about education, the Army was about education, and you're about continuing education and doing. I think it's important that we focus on that. So as a veteran, stay tuned in, plug in, and know what's going on, because your VA is here to help you. And just as I said to the old gentleman, get your hearing aids, get where you can hear. And he said, well, what are they going to do, Jimmy? I said, they're going to give you free hearing aids and a puppy. So, hey, have a great day. We're going to be right back in a few minutes as we wrap this up. We're talking with Dr. Wendell Jones, the director of VISN17, State of Texas. We're here for you. This is Alliance for the Brave.
Look at the time. Okay. I'm so busy. I can't even look at the time on that watch. There's so much other stuff going on.
They make various kinds.
Okay,
sports
guys.
Watches.
My watch, I've had this watch since 1967.
Wow.
That is
I cannot say.
Yeah. I
Wow.
bought it in Yokosuka, Japan at the Navy Exchange, and I wore it in Vietnam, and I've had it reworked several times, and I wear this. I wear it more for sentimental value than anything.
Yes.
But having a great watch, man, and I love that.
But Dr. Jones, do you want to still touch on the Afghanistan?
Oh yeah, we got to talk about that.
Because I know you wanted to.
Yeah.
All right,
you
so
wanted to kind of.
all right, London, when we come back,
Yes,
I'll
sir.
bring us on. Throw that to him. Okay, with you and you two guys with that pure.
Yeah.
Now, remember, gentlemen, and he knows this, but you don't. This is a real short segment.
Okay.
So focus.
Okay.
Keep it, and then we close with a prayer.
Okay.
And I think it's important that we get that out.
Yes.
Okay. Are you having fun?
I'm having a great time.
Really?
Yeah, this is fun.
Okay. I owe you an apology. Where do you live? What part of
South Lake.
South Lake? Oh man, it's just right up the road.
Right.
Well, I'll tell you what. Next time you come back, that we get to talk about more things, well, we'll take you to lunch, and there's a bunch of great places up there in South Lake or along the interstate. But it gets us a chance to really get to know you. We also have toyed with, and now we've decided we're going to put together an Alliance for the Brave lunch and learn. And we'd like to have you and maybe Dr. Holt and even Dr. Hastings come
Okay.
to do a roundtable that we would pay for a lunch and learn for people to come
That'd be fun.
and participate.
Sure. That'd be
Wouldn't it
great.
be fun?
That'd be a lot of fun.
Yeah. Now, I don't know a good place that serves soft shell crabs. You're from, how do you say, Balmer? How do they say
Yeah,
it?
you never say the T. If you're from Baltimore, you don't say that. You say Baltimore, or some folks say Balmer.
Yeah. Love doing it. And we have always been able to be supportive. And I have been asked and served with the group of guys called the Stakeholder here in Dallas. You probably know Ken Watterson and all those guys.
yeah.
And so I'd like to get more and more involved. And I told Dr. Holt, I met with him as he wanted to be on, and I said, look, I got a dream that we need a Veterans Resource Educational Training Center that provides certifications and training to to help veterans get jobs or get better jobs. Because London and I have interviewed so many major companies that are doing that kind of training and certifications.
Right.
We had 2 weeks ago, we had Erica on from, what is it? And then we had the lady Kim from National University. We had Operation New Uniform. So we've got the companies, and I met with Dr. Holt, and we toured that Garland facility, and we found a building. We're going to put it together.
You're listening to Alliance for the Brave, honoring, serving, and empowering those who serve our great country in the line of duty. Today's program is presented by Gear Services Web Design. Learn more about our mission and how you can plug in with us at allianceforthebrave.com. Now, back to the conversation.
Well, welcome back. We're about to bring this program into the dock. I want to have a special thank you to Robin Valtudo, our executive director, London Mason being part of the team, Chris running the board, my wife Diane, Atoya. Everybody puts together a great program for you. So thank you for being on board. London, you had a question for Dr. Jones?
Dr. Holt, as we close, you know, you're very aware of the Afghanistan withdrawal. Can you just give us a little bit of your perspective on what you see and what do you think is needed during this time from your perspective?
Yes, this is a crisis that we've all been watching over television, hearing over radio, etc., even reading on our cell phones the daily activities on what's going on in Afghanistan. And of course we lost 13 service members just a couple days ago, which was very unfortunate. With this, many of us have thought of our past experiences either in that part of the world or even Vietnam, because there's some comparisons that you can do between the withdrawal troops in Afghanistan and Vietnam. So with that, you may need some mental health help, and we ask for those that are going through those experiences to reach out and get that help in mental health. And actually, London, you can talk to them about how they can do that.
Yeah, and definitely, you know, you guys that are struggling, and I can feel the struggle. Jim, you can feel the struggle, and just call the Veterans Crisis Line. Call someone, get someone on the line, so that you can get plugged in, hear someone. Maybe you just want to talk. You know, maybe you just need to be able to get out what you want to get out so that it can be clear that you have a better understanding. What you did overseas is not anything that no one should talk bad about.
Especially women, because I think there's a lot of women that have real problems. So the Veterans Crisis Line is 1-800-273-8255. Press 1 if you're a veteran. Again, that's 800-273-8255. Press 1 if you're a veteran. In London, there is a new number that's going to come out that's a 3-digit number.
It will be a 988 number.
It's not activated.
And you can still do the text. You can still call the normal number, but that'll roll out next year.
You know, the good thing is if you put your smartphone up and you say, "Hey Siri, give me the Veterans Crisis Line," it pulls it up for you. You don't even have to remember that number.
Mine doesn't. It says, "What do you want?" Hey guys, this has been a wonderful chance to get to know you, Dr. Jones, and have you on board. We'd like to have you come back because it's important that the health care of our veterans, but it's also, it extends out to our community, because again, the health of the nation starts right with the VA, and a lot of people don't understand that or don't know that. So I'd like to close with a prayer. Lord Jesus, we thank you for being with us, for guiding us and directing us. Lord, we pray for our active duty military, especially those in harm's way right now in Afghanistan, serving to protect. God, we thank you for them. We ask you to protect them, protect the civilians there. look after our active duty, look after our veterans, and guide and direct them. And thank you for the VA healthcare system, and thank you, God, for protecting them and helping them, especially our medical professionals as they're faced with this COVID threat. So, Lord God, we thank you with all our heart for blessing us, giving us the opportunity to serve, and continuing to serve. This we pray in Christ's name today. Amen. Dr. Jones, this has been a blast.
It's been great for me. Thank you for having me
Really?
on. Yes.
Good. Okay, so this has been Alliance for the Brave with Dr. Wendell Jones. You can go to YouTube and find it. You can take a look on Facebook and find this. It is going to be posted on our website as well. Go to allianceforthebrave.com and you can find out all about us. If you want to pose a question, send it to us. We'll handle it. We get calls. Thank you for listening in Phoenix. Thank you for listening in Jacksonville, in Norfolk, in Iowa, and Chicago, and San Antonio, and California, especially those in Northern California, because you are under so much stress from the wildfires. Thank you, God, for taking care of that as well. So this is Alliance for the Brave. I've had a great day. Dr. Jones, you've had a good day?
I've had a great day.
Really?
Looking forward to many more.
Oh,
Truly, thank
man,
you,
let's
Dr.
do
Jones.
that. Let's do that. Now, again, if you want to sign up for the VA, go for it. You need it.